Mr. President, distinguished colleagues, the Senate notes with alarm the decay of infrastructure in public health care institutions in the country occasioned by epileptic power and inadequate water supply, resulting in unhygienic conditions, which further increases the risks of hospitals' acquired transmitted related infections. Further notes that critical diagnostic equipment such as MRI, CT scan, ultrasound, and other related medical equipment essential for providing efficient diagnosis are either non-functional or dysfunctional or are completely lacking. These are life-saving equipment in diagnosis. The absence of medicaments and drugs, which are inadequate and in most cases unavailable to dispense to the patients who throng these facilities in search of the last-minute treatment for their various conditions and ailments. Concerned that this situation has compounded the dearth of ability to attract the required caliber of health professionals and skilled manpower in our public health institutions, with doctors and other health care professionals living for greener pastures daily to private medical facilities or even completely abroad outside the country. Further concerned that the sorry situation in our public health institutions has resulted in increased medical tourism by Nigerians, with the attendant outflow of hard-earned foreign currency that is rather even unavailable. These run into billions of dollars spent on medical care annually in Europe, America, Asia, and even some of the African countries, to the detriment of our own health institutions. Regret that this sorry state of affairs has rendered our hospitals and other health care facilities ineffective, resulting in dire consequences for the entire citizenry. Regret that this sorry state of affairs recently precipitated the report by UNICEF in its latest statistics on child mortality, ranking Nigeria second highest in the world, with losses of about 2,300 children under 5 years old and 145 women of childbearing age on a daily basis. Mr. President, distinguished colleagues, the intent of this motion, as I have said, is to clamor for the necessary attention and support the public health sectors require within our own polity today. Certain questions stand unanswered, Mr. President. Is this state of these hospitals the best we can afford as a government? Can't we afford better condition of some of the facilities that are now made available in these health institutions? Are we not encouraging the unfortunate medical tourism that has now become prevalent, mostly, particularly, Mr. President, distinguished colleagues, on particularly the higher echelon of the society who thrown out of the country for one reason or the other? Are we really, by doing what we are doing, encouraging the development of medical experts within the Nigerian soil? If we take, Mr. President, a model, one hospital, a health institution around the country, and I take one, the one I know most, better, closer to me, the Ahmadu Bello University Teaching Hospital. Simply put, that is the hospital that attracts the greatest number of human traffic within the Northwest Zone, within a catchment population of over 40 million people. The deplorable condition of that hospital, the equipment, Your Excellency, my distinguished colleagues, cannot be overemphasized. The situation is not any much different in most health facilities of that caliber around the country. Mr. President, I have two prayers which I will put before. Urge the executive to declare a state of emergency in the public health sector in the country. Prayer number two, urge the executive to provide special funding for the overhaul of at least one government-owned medical facility in each of the 6 geopolitical zones annually for a period of time. I so move, Mr. President.